Alright, we're redoing, this is Unit 2, Video 9. We're finishing up the integument with these skin disorders. So, I was in the middle of making this video and my iPad got a phone call, so that's why some of this information is already up. But, so a skin disorder is just something that's abnormal to what we consider normal human physiology. It's not anything bad, it's just different. So let's talk about some of these skin disorders. The first one is acne. We've already talked about this. We know that we have these sebaceous, these oil-producing glands producing this stuff called sebum, and this bacteria can feed on the sebum and that produces acne. So we're just adding a little bit more detail, just talking about how it's staph bacteria that cause this. We also know testosterone increase, this is an arrow, increase that activity of the sebaceous glands, so that's why pubescent boys have the worst acne typically. Next is lupus. So lupus has a few different things. We have these lesions that look like wolf bites, that's something that's common. We have these other common things like butterfly rashes, that's that rash across the bridge of your nose, and this is most common in not post-pubescent. This is post-pubescent. This is really, it's around when you're getting close to menopause. So yeah, post-pubescent woman is the most common for lupus. And another thing you can get is kidney failure. So what are you looking for with lupus? You're looking for these lesions that look like wolf bites. You're looking for this butterfly rash. You're going to be checking kidney function. And you'll especially be concerned if you get these symptoms with a post-pubescent woman. Next is psoriasis. It's this itchy, scaly skin. Here's some different things that can cause it. Things like trauma or infection or stress or different hormones might have an autoimmune component, and some different therapies is phototherapy, so using light waves, and steroids. All these skin conditions we're talking about, these are just basic vocab words that we might have a question on the test about. There's not a lot of physiology behind them. Alright, decubitus ulcers, these are also known as bed sores. So what happens is you have constant compression whenever you're laying in a bed. You don't have to be laying in a bed to get a bed sore. This is just one way to get it. But that constant compression causes a reduction of blood flow to the skin, and so that skin dies, that tissue dies, and then you have this necrotic tissue, and that death spreads. So caused from prolonged constriction or compression of the skin. So if you have on a cast on too tight, you can have this happen too. And yeah, horrible odor. Foul. Alright, this next one is vitiligo. This is the most common this is the most common pigmentation disorder. So might have a genetic component. It appears to be an autoimmune in function, and what it is, it's these patches of skin. We have a lack of pigmentation here, so we have a lack of melanin or these other pigments. So vitiligo is patchy skin due to absence of pigmentation there. So all this, I was drawing someone with a nice tan earlier. So all this still has pigments, but then we still have these white splotches or these pink splotches. And this is because of an absence of pigmentation. So we either have a complete loss of melanocytes here or this uneven distribution of melanocytes. So this is absence of pigmentation in certain places. Where? In the spots where you don't see dark skin. So this other absence of pigmentation that occurs is albinism. So you've heard of someone being albino. This is the complete lack of pigmentation, and this person can't produce no tyrosinase. This person can't produce tyrosinase, not in the skin, not in the eyes, not in the hair. So we get this complete, complete lack of pigmentation. All right, so we've seen this uneven distribution of melanocytes with vitiligo. Now let's see an uneven overaccumulation, an uneven over-distribution of melanocytes, and that's freckles. So once again, here's my skin, and we'll just say that I'm fairly pale right now, and then I get these freckles. And all these freckles are an overaccumulation of melanocytes, an overaccumulation of melanin of this pigment within the skin. All right, I think we have a few more. Just birthmarks. So again, this freckles, patchy pigmentation disorder due to this overaccumulation of pigments. It's more common in fair-skinned people, and compared to people with darker complexions, it's most common in redheads. And then last but not least, we have these birthmarks. What's a birthmark? It's a dense collection of capillaries in the dermis of the skin. So dense capillaries in the dermis. If you guys remember that dermis, we had blood vessels associated with that connective tissue. So these capillaries, these small blood vessels, there's a lot of them. Dense caps and dermis. Cool. We call this a dermal capillary accumulation. And unknown cause, but they're present from birth. All right, that's it for these skin disorders. So this finishes up our integument system.